Hello and welcome back to my channel. I have been off air for about 6 months, but I am back now. I will be making videos at least twice a week, and so please check on my channel every Wednesdays and Thursdays for new videos, and please don't forget to subscribe and like my videos. Now let's dive into healthcare management curriculum. In the previous video, I mentioned I will be doing my next video on the healthcare management curriculum. Here we are, and there we go. So these are the major subjects that you will be taking in healthcare management degree course, and this is the bachelor's of science in healthcare management degree program. The major course subjects, or you will call them electives, without this course you cannot graduate from any college or university with a bachelor's degree in healthcare management. There are about 14, and the last one you'll be taking a capstone project. What I want to do today is to explain into detail or give elaborated summary on each and every topics you see over here, or each and every subject that is listed here on this video. Now before that, let me show you my personal journey. I graduated from Harrison University in 2017 with a Bachelor's of Science in Healthcare Management. This school is located in the United States of America, and I know some of you might be watching this video from everywhere in the world. Before you can take the major courses, you have to have core subjects. Every school have core subjects in the curriculum that you have to take before they allow you to move forward. Probably you might start taking the courses in healthcare management in your sophomore or in your junior to senior years. But in your freshman years, you will be taking a whole lot of the core prerequisite classes you needed in this program. Now there are a couple of lists here. I have taken finance, I have taken principles of microeconomics, English composition, speech, English composition. The second one, that is composition, is just about a little bit of literature and a little bit of just those tense and past tense and whatever it is of every story that you might read. So that is just about English, and that there's a lot of them. I can't read all of them out of here now, but I believe when you get chance and you watch this video, you will see them. They look very tiny on the page, but you can actually stretch it to see how the bigness of the words, so you can read them. But I can say I have taken college algebra. I have taken some of the courses. I took it from a different college or university and transferred to the university in which I graduated. I have taken accounting, computer and application courses, computers and application software. I've also taken quantitative decision making, have taken information literacy, critical thinking, and cultural diversity. Those are the prerequisite courses from the college where I graduated from. but every college have different prerequisites. Now, in the next video, I would like to go a little bit into detail of every subject and what you want to expect, what you should be expecting to learn in each subject. I'll just summarize it. I can't go like full detail. If I go full detail, the video will not be over. So I'll just brief it a little bit so you can understand what you should be expecting when you take this course. Like I said, when we go back, you will see these are the major course subjects. Now, the first one is Introduction to Healthcare Management. This school actually put it into two forms, 1 and 2. So I actually just put the summary of the 1 and 2 over here. So now 1, this course lays the foundation of the healthcare system as it relates to healthcare practice management. Its focus is on the history, evolution, and development of the present American healthcare system, including the roles of the various healthcare providers. So the first subject, which is Introduction to Healthcare Management 1, talks about that, and that is what they're going to teach you in class. But you will have a lot of things. You're going to have quiz, you're going to have assignments, that is a written assignment, maybe 3 or 4 pages of paper to write. You're going to have books to read. They'll give you a particular book that you're supposed to buy to use for your studies. Just like normal college, everything the structure is the same, but the course details is what differs. In the second subject, which is Introduction to Healthcare Management 2, the course offers an overview of practice management principles and functions within ambulatory healthcare settings and organizations. It has topics including business operations, care systems, and organizational dynamics and leadership. The third subject you will have to study as your elective subject in healthcare management is healthcare terminologies. I remember many people in the healthcare setting study anatomy and physiology. If you want to be a nurse, if you want to be in a direct care, that's what you study. But here in healthcare management, well, a healthcare management consultant, your job is to manage the entire facility. You are not managing the workers. That managing the workers or the subordinates in the business, it is administration, kind of related to administration. So this career, administration, is related to healthcare information management. But in healthcare management and consulting, you manage the entire facility, like you are the boss of the entire business. From the nursing department to the administration department to every other department that is within that organization, you are the CEO of it. And when you are a consultant, meaning you probably have a bigger role of managing 3 or 4 hospitals that you have to have people like subordinates under you that work with you to be the best consultant. So don't be confused when you see terminology. Now, The healthcare terminology, this particular subject has a basic level medical terminology course for those who plan to be involved or are already involved in a healthcare profession field. The course will cover the definitions, spelling, and pronunciation of medical word roots, combining forms, prefaces, and suffixes, and medical abbreviations. Healthcare practice business terminology is also addressed in this course. The next subject, professionalism and communications in the healthcare setting. A course in professional standards for practice managers. Participants in this course will gain knowledge of how to effectively communicate within healthcare settings. Consideration will be given to understanding the range of stakeholders in healthcare settings, the impact of social media, how to effectively communicate with patients and families, and the role of communicating for purpose purpose and policy changes. Students will develop personal communication skills and gain understanding of the importance of collaborative problem solving, cultural sensitivity, and the need for continuous learning through presentations, case studies, and written assignment, like I said earlier. All right. The next subject is human resource management with a focus on healthcare. Human resource management includes legal, behavioral, and administrative aspects of the personnel management. Students will enhance their managerial skills through deeper understanding of recruitment and retention of personnel training and evaluation practices, compensation and benefit systems, in addition to the impact of legal and regulatory environments. Okay, pardon me for a second. Okay, the next subject we will focus on is healthcare compliance and quality. This course is an in-depth examination of quality and regulatory compliance issues associated with a healthcare practice environment. It offers a broad base of fundamental compliance knowledge with real-world situations, as well as the study and application of regulatory requirements for quality and performance improvement. Topics include an overview of the OIG recommended compliance program for physicians, coding and billing in reimbursement issues, and discussions related to compliance with regulations and status. For example, the OSHA, the CLIA, the HIPAA, privacy and security, and other quality-based programs affecting healthcare such as pay for performance and RAC programs. Students will explore quality improvement techniques with an emphasis on the roles of patients and health professionals in improving healthcare delivery outcomes, tracking analysis and impact on practice performance and patient care. So that is what does healthcare compliance and quality subject entails. It's going to be very fun. Now the next subject you're going to learn in healthcare management program is revenue cycle management. It is critical to the success of the medical practice. In addition, the coding aspect of provides a basic for billing and quality assessment. Practice topics include the evolution and current practice of ICD diagnosis, coding, procedure coding, coding guidelines, how codes are used for claim submission and processing, determining medical necessity, payment methodologies, and account receivable management strategies. These are everything you are going to learn in this particular subject. The next subject you will come across is healthcare informatics. This course provides an in-depth multidisciplinary analysis of the strategic management of information technology in healthcare organizations. Specific topics include electronic health records, health information exchange, the impact of information technology on quality of care and patient safety. Students will focus on information system acquisition and the implementation process, including assessing the need for information technology, cost analysis, and justification, request for proposal, process and implementations. The next subject will be medical law and risk management. Course participants will examine decision making along the legal and ethical dimensions of practice management. Course concepts include the current healthcare environment and the types of practices and licensing and certification of healthcare professionals, criminal law and tort that are relevant to the healthcare profession, as well as ethical theories, morality, employee and patient's rights and responsibilities, consent, legal reporting, professional liability, and end-of-life issues. Additionally, students will explore various risk management strategies, including the development, implementation, and maintenance of policy and procedures to prevent or minimize the impact of adverse events. Next subject: financial management in healthcare. This course applies financial management principles to practice management and healthcare system. Topics will include resource allocation, cost analysis, and funding sources, as well as how financial decisions are made, reported, and implemented in practice management. The next subject is patient partnership and population health management. Patient partnership and engagement is the key to a successful practice and healthcare system. In this course, students will have the opportunity to examine formal and informal programs and strategies used to make this partnership and engagement enhance the medical practice, performance, quality care and outcomes, and patient satisfaction. The next subject will be healthcare management, practicum, and seminars. The practicum is designed to give students the opportunity to learn about practice management by immersing themselves in the daily activities of a practice management professional. During the practicum, students often observe meetings, work collaboratively on site projects, conduct informational interviews with the goal of increased understanding of the profession and potential career paths. Specific assignment during the practicum will be tailored to the opportunities available at the assigned site. The next subject, which happens to be the last subject you have to take before graduating with a bachelor's degree in healthcare management, is healthcare management capstone. The capstone project is the culmination of the student's academic experience. In this course, students will examine current healthcare policy and emerging trends. They will be asked to identify a current problem, initiative, or issue in healthcare practice management and analyze that topic from multiple perspectives, drawing on knowledge gained throughout the program. The goal of the capstone is to develop a deeper understanding of a topic of importance in practice management, to study available options, programs, and relevant research, and to generate and present practical solutions to clients and colleagues. And I will tell you, you're going to write about 35 pages of a project's work. So by the time you are done with healthcare management, you should be a writer. You will be writing something a lot for capstone. Probably I wrote about 40 pages of a choosing project. They will ask you to choose a topic like you are acting as a manager or a CEO of a nursing home, and you have to write all the details of that in the capstone project. Maybe you might be given a different topic, depends on what your choices are, what's impress you, what you want to do, and that is what a topic is going to be on, and you'll write about 35 to 40 pages of it. And I was asked to post mine on LinkedIn, social media, so you can be asked to do the same or maybe do something different, depends on the school you choose. Reference. This is where I get most of the information from, this website. And on the last page, I will say the next video is going to be on healthcare management careers. And you already know one of these career is healthcare consultant. Healthcare consultant have a lot. Now in my next video, I'm going to list some colleges and universities that offer the healthcare program around the world. Some of them have online version, and some of them have in-person version of the course, and some offers both. So in my next video, I will do that. I got some comment from the previous videos. This is coming from one of the viewers. This person says, I appreciate the time and effort you put in these videos. Please keep them coming. Thank you very much for that wonderful compliment, and I will keep on bringing in more videos. The next person asks a question. Hello, I have an inquiry on what colleges do you think are the best for healthcare consultants and what are the best degrees? Yes, in my next video, I will elaborate on that. And the other question this same person asks is if you could please be diverse with your options for universities and colleges around the world. Indeed, yes, there are a lot, tons, dozens of universities around the world that offers healthcare management program, healthcare management course. You can have different courses that can lead you to healthcare consultants. You can even have bachelor's or master's degree in healthcare information management. So the next video, even though I promised to talk about healthcare management careers, I will elaborate on all other career courses or programs you will study that can fall beneath the healthcare consultant career. Thank you all, and once again, please subscribe, and like my videos. Thank you so much. I'll watch you or I'll talk to you in the next video. Bye.